when the Health Secretary got COVID, the Prime Minister and Chancellor got pinged. Sajid Javid's symptoms are mild, but there was more than mild fury this morning when Number 10 announced Boris Johnson and Rishi Sunak would be taking daily tests and heading into work, rather than self-isolating. At breakfast time, this minister defended the plan.
This is a long-standing pilot. It is being used by a range of different public sector organisations like Border Force, like Transport for London. More broadly, though, we do urge people to continue to take action when they're approached by NHS track and trace. It's a really important part of our arsenal to tackle the virus.
That went down like a lead balloon and prompted one of the fastest ever about turns by government. At 8 this morning, Number 10 said the Prime Minister and Chancellor would avoid isolation because
they will be participating in the daily contact testing pilot to allow them to continue to work from Downing Street.
But just over 2.5 hours later, a hasty change of plan and a new statement announcing
the Prime Minister was at Chequers when contacted by Test and Trace and will remain there to isolate. He will not be taking part in the testing pilot. He will continue to conduct meetings with ministers remotely.
At the same time, on Twitter, Rishi Sunak said he recognised that even the sense that the rules aren't the same for everyone is wrong. I'll be self-isolating as normal and not taking part in the pilot. But opposition parties say the Prime Minister and Chancellor avoiding isolating, it was never going to be a good look.
Hundreds of thousands of people are having to self-isolate and they're doing the right thing. What happens when the rules apply to the Prime Minister? He tries to wriggle out of them and to pretend that he's on some pilot scheme that exempts him.
This afternoon, Boris Johnson posted a video recorded on his phone, trying to explain things.
We did look briefly at the idea of us taking part in the pilot scheme, which allows people to test daily. But I think it's far more important that everybody sticks to the same rules. And that's why I'm going to be self-isolating until the 26th of July.
But there'll be no U-turn on so-called Freedom Day tomorrow, the end of almost all social distancing in England.
Lots of people have now been vaccinated and our business needs to get back to functioning as a normal pub.
Rob Starr is glad Boris Johnson's giving his business its freedom, but angry the Prime Minister even considered not self-isolating.
We've had numerous staff that have been pinged by the app. They then have to go into isolation. Only last night my ops manager was managing one of our pubs in King's Cross because we just don't have the staff because people have been pinged. I'm actually on the rota in that pub next week and it is a real issue for us, yeah. And it shouldn't be one rule for the government and another rule for hard-working business people.
To be accused of being out of touch isn't what Boris Johnson wanted on the eve of restrictions being lifted. And now he'll be stuck indoors on the day he says the country can move forward.
Well, I'm joined now by Professor Andrew Hayward, Director of the Institute of Epidemiology and Healthcare at University College London. He also sits on the government's SAGE Advisory Committee. Professor Hayward, we are on the eve of restrictions being lifted in England. What are your thoughts on that?
Well, before I start, just to say I'm speaking in a personal capacity rather than on behalf of any committee.
Understood.
Yeah. And I'm sorry, could you repeat the question?
What are your thoughts on the fact that we are lifting restrictions in England tomorrow?
Well, I think it's not so much a question of when we lift restrictions, it's a question of how much behaviour changes when we do lift restrictions. What the modelling is showing is that if we all do continue to be quite careful and don't go back to normal activity, like pre-pandemic activity, then we'll still see quite a large wave of infection with up to 30 or 40,000 deaths and maybe 250,000 hospitalisations. But if we all just move back to normal, the figures could be much worse, maybe twice as bad as that. So it is very important that despite the lifting of restrictions, we do continue to take some precautions.
Is it realistic to expect people to take precautions if restrictions are being entirely lifted? I mean, we're opening up nightclubs. What kind of precautions can people take in clubs?
Well, actually, it's quite interesting when you look at some of the surveys that have been done recently about what people intend to do. A lot of people intend to continue to use face masks, to continue to avoid crowded spaces, and I think both of those things are going to be important. Basically, the way that you can reduce your risk is to reduce the number of times you go out to do things every week, and as well as keeping the number of people that you're in contact with down. And that will help reduce your chance of getting infection, because the vaccine isn't perfect, and of passing it on.
I know you don't want to be drawn into politics, but we have seen a situation today where the Prime Minister and Chancellor weren't going to self-isolate, now they are going to self-isolate. Is there a danger that public health messaging has become confused here?
Well, I think it is really important that we're very clear about our public health messaging, and if we want people to self-isolate following contact, which I think is still really very important, then it's important that that rule applies to everyone.
But there is a contradiction, isn't there? Because we're lifting restrictions at the same time infections are rising, and many people are being pinged on the app or being told to self-isolate by test and trace. That's not a sustainable situation, is it?
Well, I think it certainly is a very inconvenient situation, and what we're likely to see over the next few weeks and months is cases of infection going up dramatically. We'll probably have the biggest wave of infection that we've actually ever seen. And that will, of course, mean that more and more people are being pinged. It's not a simple linear relationship. Actually, the more infections there are, the more people who are out and about, the more people will be being asked to self-isolate. So again, I think it all points to not rushing straight back to normal activities, but to continue to be cautious. If you can work from home, then I think it's still important to work from home.
OK, Professor Hayward, thank you very much for joining us.
Pleasure.